Hi everyone, my name is Pat Hartley Gibson and I have the same problem as many millions of women do. This video is to assure women who feel they have excessive body hair that they are normal and just as special as every other woman on this planet. Please note that this video is not intended as a substitute for medical advice. You should consult a doctor in all matters relating to your health, and particularly in respect of any symptoms that may require diagnosis or medical attention. All women have hair on their body and faces, but this is usually very fine and light in colour. If it grows thick, coarse and dark, it can be embarrassing. The name given to excessive body hair on a woman is called hirsutism. Hirsutism is not as uncommon as you think. It's estimated that up to 15% of women suffer from hirsutism of different degrees. It is more common in Asian and Mediterranean women and in women with darker head hair. So, what are the causes of hirsutism? There can be many reasons for excess facial hair in women. One of the main causes is due to the action of androgens, the family of hormones that includes the most well-known testosterone. Though androgens are loosely called male hormones, this is misleading. All adult males and females have biologically active levels of testosterone in their blood. In males, androgens stimulate sexual feelings, but their role in this regard is far less clear in women. All women produce some testosterone. However, women's levels are usually only 5 to 10% of men's levels. Higher than normal levels in women may increase her sex drive, affect the menstrual cycle, and produce excess facial and body hair. At puberty, testosterone levels begin to rise in both sexes, but much more sharply in boys. Some of the normal events produced by androgens at puberty are the appearance of pubic and underarm hair. While we think of these as the only places a woman has body hair, most have some on other areas as well: lower legs, upper thighs, between the navel and pubic region, on the chin, upper lip, lower back, neck and cheeks. For a few, the amounts are greater, and embarrassment and self-consciousness as a result. One of the main causes of high levels of male sex hormones in premenopausal women is polycystic ovary syndrome, a condition which causes cysts to grow around the edge of the ovaries, the organs which produce eggs and sex hormones. In premenopausal women, some have increased sensitivity to male sex hormones rather than increased levels. This means that they can have a greater effect on the body, causing things like excess hair growth and a deep voice. The cause of excess hair growth in women who've already been through the menopause is usually a hormone imbalance resulting from the menopause itself. Surprisingly, and I've experienced this myself, women with hirsutism are often not believed when they turn to their doctors for help. Some doctors may tell women that the condition is hereditary, with the implication that nothing can be done about it. While there is no question that some families and ethnic groups have a tendency to more hair, this does not mean that they cannot benefit from treatment. Women with increased hair should not be put off by this attitude. So, how much hair is normal for a woman? Well, I can tell you this, there is no absolute answer. You may be surprised to know that half of American women remove facial hair at least once in a while, and 10% remove it 2 or more times a week. And many of the women who have hirsutism remove more often than that. Some even use a razor once or twice a day because their facial hair grows as quickly as a man's. In the media, photographs of women do not show how much facial and body hair they really have. The result is that women with an average or slightly more than average amount of hair think they're abnormal. Feeling like this can create a feeling of isolation. I'm here to tell you there are millions of other women who have hirsutism around the world. Reality check: heavy hair growth on women is not as rare as people think, because women with this problem do all they can do to hide it. Most never discuss this problem with friends because they feel so embarrassed about it. If you suffer from hirsutism, Have you ever found yourself not wanting to sit under a particular light because it could show your stubble? Or do you carry a pair of tweezers and a small mirror everywhere you go, and at any opportunity manage to sneak peek and check no unwanted hairs have appeared? In our modern world, have you noticed that a woman on TV or in films or magazines never seems to have any extra hair? The reality is different. There are some really well-known actresses who have a considerable growth of facial or body hair, but they either wax it off or the camera is kept slightly out of focus, a trick also routinely used to hide wrinkles. And as we all know, magazines are known for retouching as a rule. Marilyn Monroe shaved her face. Elizabeth Taylor shaved her face. If you suffer from hirsutism, it's definitely worth visiting your doctor and finding out about the possibility of having your hormone levels checked and other possible investigations into the reason behind the extra hair growth. Do not be put off by your doctor's attitude if they try and fob you off. Be firm. If you don't get anywhere with your doctor, try another one. There is no cure for hirsutism, but there are treatments to manage the condition. Here are a number of hair removal methods that may help. Shaving, snipping with scissors, tweezing, plucking, waxing, threading, intense pulsed light, bleaching, and the contraceptive pill. Tweezing is the worst because it pulls the hair out by the root, which injures the skin. A bumpy look to the skin may occur if this is done over a long period of time. Snipping with scissors does not last as long. Depilatories are hair removal creams that can be used on your legs, underarms, and facial areas. Make sure you choose the right cream for the area you are treating. Do not leave them on longer than the instructions say, otherwise there could be considerable irritation. My experience? I found this treatment works well on upper lip and chin. A razor is an effective way to remove hair, but many women understandably do not like to use this one. Despite widespread belief, to the contrary, removing hair by a razor or other means does not make it grow in faster or darker. My experience? Not tried this one. Facial threading practitioners pull hair out by a thread in a crisscross movement. This will need to be repeated every 2 to 6 weeks. Levels of pain do vary between women, but it's generally believed to be less painful than waxing. My experience? One I've not tried yet. Electrolysis is a well-established method, which is permanent. Continuing treatment is often needed for women with substantial hair growth because new follicles become active. To get a good result, electrolysis needs to be done by a skilled professional using proper equipment. My experience? I persevered with this treatment for months, even though I found it quite painful. I ended up with folliculitis and gave up in the end. Laser treatment has been heavily promoted over the years. It is said to offer permanent hair reduction. Pigmentary changes may occur from laser treatment, and it's therefore not suitable for those with very light or very dark skin. My experience? I haven't tried this method. There is a possibility your skin can be burned during this treatment, which kind of puts me off, plus the fact it can be very expensive. Intense pulsed light is similar to laser treatment, but uses various light wavelengths, as opposed to laser removal, which uses a single wavelength. This is aimed at reducing the risk of burning. This treatment is not suitable for women with darker skin tones. My experience? Gosh, really, really painful, especially on the top lip area. I did about 9 months treatment, and for the pain, the expense, £40 per treatment, which is roughly $60 for lip and chin area, and the results, I decided it wasn't worth it. Waxing is effective if done regularly, around every 2 to 6 weeks, and may reduce regrowth. However, it may be painful and can cause redness. My experience? Painful and the pain doesn't ease with time. I found this the only effective way of treating my bikini line without causing irritation. It lasts about 2 weeks before regrowth starts. The contraceptive pill. For some women who've not yet started the menopause, taking a contraceptive pill may control hirsutism. My experience didn't make the slightest bit of difference to me. Other treatments. There are also a number of unlicensed medications that have not been specifically tested for this purpose, that are actually known to be effective. A note of warning: in some cases treatments can lead to irritated skin or inflamed hair follicles, folliculitis. Folliculitis usually takes a few weeks to resolve itself and may mean that you can't continue removing hair until it clears up. As the life cycle of hair is around 6 months, treatment can take this long to work, so it's important to start treatment as soon as possible. Also, be aware that new hair follicles can be stimulated when using treatments. In my experience over the years, you're best trying out different treatments to find one that suits you. My advice? Test, test, test before you treat a wider area, especially on your face. And remember, do not despair if you have excessive bodily hair growth. Whatever you've been told, it is possible to find out what is causing unwanted hair growth and to get effective treatment. Treatment will not necessarily remove every unwanted hair, but can reduce it considerably, making removal much less of a burden and giving you peace of mind. And remember, you are beautiful. Learn to love the skin you're. I do hope this video has made you feel a little less isolated, knowing that there are millions of women just like you and me out there. With love. This video is not intended as a substitute for medical advice. You should consult a doctor in all matters relating to health, and particularly in respect of any symptoms that may require diagnosis or medical attention.